Hello everyone. In the spring of 2013, the Partnership for a Healthier New York City put out a request for personal stories from New Yorkers about how alcohol caused problems for them, their families, or their communities. In response, they received hundreds of powerful and illuminating stories. Here to tell us more about uncovering alcohol's hidden harms is alcohol policy analyst of New York City Department of Health and Mental Hygiene, Aviva Grasso, and Laena Orkin, the program manager of alcohol education at the Partnership for a Healthier New York City. Welcome, ladies.
Thank you.
So, you put out this campaign. Which organization put out the campaign?
The Partnership.
The Partnership. So you put out this campaign asking for stories. How many stories did you get? What was the response like for you?
Sure. So at the Partnership, one of our goals is to raise awareness about the hidden harms of alcohol, and we figured a way that we could do that would be to collect stories. And so we asked New Yorkers of all ages from every borough of the city, and we collected over 300 stories. And they ranged from topics around quality of life. So, for instance, being in a neighborhood where there's lots of binge drinking going on, it's hard for neighbors. It can be loud, hard to sleep. There could be vandalism in the street. We also got stories around violence, which is a high priority issue in the city. For instance, there was a story about a young person whose mother was actually murdered due to someone drinking, and even another story about young people being at a house party and there being drinking involved and people getting into a fight. And so there's many more topics covered in the book, but those are just a few. But we really the goal is to try to highlight some of these stories and show collectively how alcohol does have an impact on our communities. And there's not just harm to individuals, but also harm to others as well.
Right. And the New York City Department of Mental Health and Hygiene, obviously they're combating constantly people abusing alcohol. Could you tell us a little bit about campaigns that New York City is putting forth?
Sure. So I guess last week we put out a new data brief sort of sharing some of the harms associated with other people's drinking. So we surveyed people in 2012. We surveyed over 5,000 people in New York City, and we asked them, in the past 6 months, have you experienced harm due to somebody else's drinking? So that harm might be something like having to take care of somebody who had too much to drink, but it might also be experiencing an unwanted sexual advance. And so about 20%, well 22% of people said that they had experienced some sort of harm. So that's over 1 million people in New York City who say that they've been harmed due to somebody else's drinking. Sort of in response to that, we recently launched a new ad campaign, which is focused on reducing that risk of harm. And so it says just one more drink can hurt, as opposed to what you always hear, one more can't hurt, right?
Right.
And so we suggest that people can keep their friends from hurting themselves or others by cutting them off before they've had too much to drink. So we're sort of trying to get at reminding people that there are, as Laena said, a lot of different harms associated with drinking too much, and that there is a point at which in social situations we have the opportunity to prevent those harms.
I think I remember seeing some ads on the subway. It says, oh, one drink ago you could have brought yourself home,
right,
or something like that.
Right, so that was the previous campaign, and now we have a new one that just launched last week. So yeah, it was 2 drinks ago.
Oh, 2 drinks ago. Sorry, 2
No,
drinks
it's
ago.
okay. One drink ago is this, right? I mean, everybody says that, there's that point, right? There's a tipping point somewhere.
Absolutely, absolutely. So we're talking about the secondhand effects of binge drinking. In the stories that you have collected, obviously those were all secondhand. Was there one story that maybe stood out to you, something that really hit home for you?
Sure. I think that it would be the story of the young person whose uncle was drinking and actually ended up murdering his mother and then took his own life. And I really feel like that story really hit me because it's a young person and they knew exactly what was going on, and they knew that alcohol was part of the problem. It just sort of shows that it's not just about you sort of harming your body through alcohol. We always talk about alcoholism, liver disease, drunk driving, but rarely do we talk about violence and how alcohol is a risk factor for violence, including gun violence, sexual assaults. And also with quality of life in neighborhoods. I think that we don't think about the fact that when you live in a neighborhood where there's lots of drinking going on, the people who live there don't necessarily like the noise and like sort of all the commotion that comes with it. So we definitely saw that in the stories, not just how people had stories about their own health, but also their family members and their communities as well.
And in terms of you're talking about communities that there are a lot of binge, we're talking about colleges, NYU area and
right,
the
Lower
Village,
Side.
Lower East Side.
Sure.
There's a lot of that going on. How do we help reduce underage drinking? Because some of those kids are freshmen, they're 18, 19 years old, they shouldn't be drinking, but they are. How do we help reduce that happening?
That's a really tough question, and it's one that people are always sort of trying to nail down, and really what we know nationally and in New York City to a lesser degree is that young people drink the way they see adults drink. So if we want young people not to drink, we really need adults to sort of rein in their excessive drinking. States that have lower rates of drinking and have lower rates of underage drinking. And so they really do go hand in hand. So another sort of angle on that is really looking at the whole environment that young people are existing in. Young people actually, I won't say college students, but high school students in New York City are less likely to drink than they are in some other parts of the state and other parts of the country.
That's interesting.
Yeah, it surprises a lot of people, but I think it's because there are so many other things to do. You talk to a young person in rural Maine, there's not a whole lot to do, so they drink. In New York City, there are a lot more opportunities for young people, so they have other outlets, other things to occupy their time with.
That's interesting. I know that there's been a debate rising with the with marijuana being legalized in certain states and in certain areas. The difference between the effects of marijuana and alcohol, and people, advocates for marijuana, are always saying that alcohol is the worst of two, and well, then if marijuana isn't legalized, then alcohol shouldn't be either. How do we counteract that argument? What is the argument there?
Well, at the partnership, we focus mostly on alcohol, and I think the reason why we like to focus on alcohol is because it is America's favorite drug. It is more used than other drugs, including marijuana, and also it affects so many things that we don't realize. And again, that's sort of why we're so focused on the hidden harms, because there's lots of talk around liver disease, drunk driving, alcoholism, but there's not a lot of discussion around alcohol being connected to other high priority issues. For instance, violence. For instance, actually, wonderful to have transportation alternatives on earlier. Actually, 1 in 3 pedestrian fatalities, the pedestrian themselves were legally intoxicated. So drunk walking is also really dangerous. And actually, alcohol is the 3rd leading preventable cause of death in this country. And so I think that's really the point of our work at the partnership and with the Department of Health, is showing that alcohol is a high priority issue on its own, and it affects many other high priority issues in our city. And so that's why I think it's great that there's a Department of Health campaign, why we've got this data brief looking at secondhand effects, and also our own book, Uncovering Hidden Harms, a collection of stories from everyday New Yorkers to help make those statistics come to life, that everyday people are being affected by this, it is a drug. We don't like to call it a drug, but it is a drug. Right. So I think that that's really important, just to sort of recognize how important of an issue it is, even though it doesn't always get the attention that it deserves.
What's funny is people don't even realize that drunk bicycling, you can also get a ticket. Sure. That's a thing.
Right.
Yeah.
Yep.
It's very, very dangerous. So where can people go to find this book? Where can they purchase it, perhaps?
Sure. So the book is free, and it's available on our website, healthiernyc.org. And we also have a Tumblr page, so we want other New Yorkers to share their story, and that's hiddenharms.tumblr.com. And also, the Department of Health has wonderful resources on their website as well. It's a really great opportunity. Sure. This is the wonderful book that we just had published.
Well, then we're on our. There it is.
There it is. And so we're really excited to get this book out to everyone, to everyday New Yorkers, to community leaders, to again sort of increase the priority level of alcohol, being an issue in our city.
Wonderful. And in terms of the New York City Department of Health and Hygiene, how can people get involved with your campaigns? How do they reach out to you?
Sure. Well, I think the easiest way is to go to our website, which is nyc.gov/health, and you can look up excessive drinking, and you can find the data report that way, and you can find the campaign that way. And interestingly, I think getting involved, the best way to get involved actually is through the partnership, where they have coalitions in all 5 boroughs, and people can get connected through the partnership's website and actually get involved in doing something about alcohol in their communities.
Great. Thank you so much, ladies.
Thanks.